Hi there, I'm Dr. Tan and welcome to my vlog. Today, I will be answering all the questions that I get from TikTok that relate to vision and eye health of young children. So when I say children, it's children for all ages, from infants, babies, toddlers, school-age children, high school, and even 18-year-old debutants. So let's answer them one by one. Are you ready? To start with, I think all patients must be screened as young as 6 months old. Okay? That's the youngest that they can see a doctor. Pero prior to 6 months, kung meron silang, ang parents, meron nang na-observe na problem sa mata ng bata, like sobrang excessive ng eye misalignment, tapos halos consistent yung kanyang misalignment, hindi siya intermittent, then kahit before 6 months, they can already visit a doctor. Or minsan naman kapag sobrang nagluluha, may epiphora, or grabe yung eye redness and all these things, they can already visit even younger than 6 months. Pero kung wala naman silang ibang nakikitang problem, we can examine a child as young as 6 months old. Ang problema nila is hindi pa nakakapagsalita, hindi pa nakakapagsabi, hindi pa pwedeng magbasa ng chart. That's not a problem at all, because if you visit a pediatric optometrist, they are trained to handle patients who are still nonverbal or hindi pa nakakapagsalita, either because of their age or because they have special needs, okay? Aside from the training that pediatric optometrists have to handle these cases, there are also pediatric optometrists who have special instruments to correctly, accurately, and quantifiably diagnose refractive errors in children, even if they cannot read a chart yet or if they cannot say anything yet, no? So, it's best to visit a pediatric optometrist as soon as you can. And then, yung pediatric optometrist, siya na magde-decide kung how often mo kailangan bumalik at mag-follow up depending on the nature of the eye problem. So, start as young as 6 months old. If you haven't done that and your child is a little grown up na, at least man lang start before class, no? Kasi ang pinaka-ayaw ko talaga, pinaka-masakit sa akin, every time I see a child na hindi nakakabasa, na alam mo yun, malaki na siya, 7 years old na siya, 8 years old na siya, hindi pa rin siya nakakabasa, tapos nami-mislabel na hindi marunong or yung poor yung academics or low IQ, na ang problema lang naman pala talaga ng bata is hirap siyang makakita. So, before school, you have your child check yung mata, okay? Para makita natin kung may problema ba or wala. And then, do this every year. Kasi minsan, for this time, walang problema, pero after 1 year, may nag-develop na problem. So, it doesn't mean na when your son was, examined when he was 5 years old and no problem was seen, he's not gonna have any problem when he's 6, 7, or 8 years old. So, you just do an eye exam every year at least. Actually, nandyan yan sa aking, patient record. Ang dami, it's a long list and I have it in my patient record because a lot of parents, when you ask them, they can tell you something, pero ang dami din nilang nakakalimutan sabihin. Okay, eye rubbing, yung nagkakamot ng mata palagi, okay? Tends to close one eye, yan, yung ganyan, nagpo-focus siya, ganon, okay? Tends to tilt head, either this, or this, my head tilting. If my family history yung parents or yung mom, yung dad na any genetic eye disease, okay? So, don't wait for any symptom, you come na to the clinic, okay? Just for prevention, just to make sure that your child doesn't have the same. Squinting or closing the eyes when there's bright light, yung pagka malakas yung ilaw or when they're out in the sun, pag nasa beach, yung ganon, yun, that's a sign of an eye problem. And then, both eyes do not move in the same direction. Yung may eye misalignment, yung minsan paloob yung isang mata or palabas yung isang mata. Okay? Next naman is difficulty copying from the board. So, ang dami kong patients dito, common sa kanila, they can see the board, kaya naman, pero ang bagal mag-copy. sobrang bagal. Ibig sabihin, hirap silang mag-transfer ng gaze from far to near and from near to far, unlike the average student. Okay? So, that's a sign of a vision problem. Crooked handwriting. Minsan naman yung isa kong patient, ang taas ng astigmatism ng anak niya, hindi niya alam, akala niya lang, parang ang tanga-tanga ng anak niya kasi may dotted lines na nga daw, hindi pa rin daw masunod. So, yun, very poor handwriting or hindi nakaka-follow ng mga dotted lines. It's a sign of a vision problem. Next is, they repeat lines or words when reading. So, nagre-read ng story, no? Tapos may nasiskip na line or may nasiskip na word or nasabi na itong line na to pero inulit or itong word na to pero inulit, no? So, that's a sign of a vision problem as well. Next is, nagko-complain ng headache when reading. Parang pag nagbabasa siya, sumasakit yung ulo niya. Or minsan naman, hindi siya nagko-complain, nagvo-verbalize na sumasakit yung ulo niya, pero napapansin mo na nagbabasa siya, nagko-close na yung eyes niya, inaantok na siya. Okay? Or sobrang tired, sobrang exhausted after school. So, a lot of children, they don't know the difference between I can't read and I don't want to read. Common sa kids, they always say, I don't want to read. I don't want to go to school. I don't want to write. When actually, what they really mean is, I can't read. I can't write straight. I can't see the line straight. No? Crooked pala yung line na nakita niya, slanted pala. So, sometimes hindi kasi ganun ka-reliable yung kanilang verbal response minsan. So, pagka meron kang napapansin na nahihirapan sa school or ganun, you go to a pediatric optometrist and have your son or your daughter's eyes checked na. Next is, kapag nagra-write siya or nagre-read siya, sobrang lapit sa mata, like ganito. Ayan, nagra-write siya ganyan. Or nagre-read siya ganun. So, that's not normal, okay? Minsan naman, sa TV, pag nanonood ng TV, kailangan lumapit. Pagka pinapaupo mo sa upuan, ayaw umupo, gusto lang niya malapit siya sa TV. Okay? So, that's a sign na paaaring may problema siya sa paningin. Okay? Other things, no, yung mga behavioral things na pinapansin namin is nagti-teeth grinding paggabi, lalo na paggabi pagka natutulog. So, there's a chance na they're really tired, stressed, and exhausted during the day. And oftentimes, this tiredness, this complete exhaustion comes from difficulty seeing things, okay? And they have to like make a lot of effort to see the board, to see what's on their paper. That's why they end up so tired and stressed at night, okay? Next naman is yung pag nag-pencil grip, sobrang tight ng pencil grip. Ayun. It can also be a sign of a vision problem kasi pwedeng nahihirapan siyang makakita ng mga words and parang nagmamanifest yung stress niya, yung complete exhaustion niya, at saka yung complete effort na nire-release niya para lang makakita doon sa grip niya. At home, you know, there's a lot of educational toys, and then when you really buy from reputable toy shops or toy stores, there's in their label kung ano yung appropriate age, para saan yung toy na ito sa appropriate age. And then next also is parang ano yung mga nade-develop nito na visual skills or motor skills. So, make sure to always read the labels of your toys. So, invest in quality toys, no? Kasi, these kind of toys, they really help the development of your child's brain, your child's ability to think, and also your child's ability to see. It's also worth mentioning na it would be much helpful for parents na they are aware kung ano yung mga visual skills and visual abilities and visual milestones ng mga bata at different age levels para matutukan nila at ma-check nila kung tama ba na nasusunod ba nung bata yung mga milestones na dapat niyang ma-hit sa bawat edad niya. Isa sa mga pinaka-common misconceptions that nearsightedness is caused by too much near work. Pag laging nagsa-cellphone, laging nagbabasa, yon, nagiging nearsighted daw. Actually, that's a misconception, that's a myth. You know what causes nearsightedness? Staying indoors. Okay? Kahit di ka magbasa, kahit di ka mag-cellphone, kahit di ka mag-tablet, pero if you're always indoors, you're still gonna have nearsightedness. Okay? So, one of the best ways to prevent nearsightedness is to have at least some outdoor time. No? 1 to 2 hours of outdoor time. Maybe 1 hour in the morning and 1 hour in the afternoon. And make sure that the sun is up. Not sobrang mainit, pero siguro mga 6 a.m., 7 a.m. in the morning, or sa gabi or sa hapon, mga 4 p.m., 3 p.m. I think 4 p.m. is enough. Kasi 3 p.m. medyo masakit pa yung araw. 4 p.m. Okay? Get some outdoor time. There's a lot of studies that show that UV exposure can prevent myopia progression. But it cannot treat myopia, okay? If you already have myopia, if you already have nearsightedness, no matter you spend one whole day outside, hindi na siya matitreat ng ganon. But it's very effective prevention management. Not just in children, but also in adults. You know, it's very good to eat green leafy vegetables. So, akala natin, di ba, lahat ng dilaw, like carrots or squash, yun lang yung best for the eye. But actually, green leafy vegetables are the best food for your eyes. Followed by the yellow vegetables, which are your squash and also your carrots. And lastly, it helps also yung ating mga fish oils, yung ating fish, yung ating omega, because it helps with the lubrication of our eyes. Yes, children can develop myopia. So, ano yung mga factors na kino-consider natin sa development ng myopia ng mga bata? First and foremost, we look into their history, their family history. If one of their parents or if both of their parents have nearsightedness, okay? So, pagka you have one parent who is nearsighted, you have 2 times the risk of being nearsighted. If you have both parents who are nearsighted, the risk becomes double. You get 4 times the risk of nearsightedness. Okay? Next is lifestyle. So, if you're spending 2 hours or more using your phones or your tablets during the day, or you don't spend outdoor time at all, okay, you are 2 times more likely to have nearsightedness. And of course, this risk increases habang humahaba yung time mo with your gadgets and with your phone, or humahaba yung time mo indoors, okay? So, and of course, we also have these combined risk factors. Like example, yung lifestyle mo, lagi kang nasa loob ng bahay, laging nasa loob ng bahay yung bata, or laging nasa cellphone, laging nasa gadgets, tapos one or both parents have nearsightedness. So, yun, nagko-compound yung risks na yun. So, there's so many types of eye movements, okay? So, let me tell you each of these eye movements, okay? So, first thing that I will discuss are the saccades. Saccades are the quick horizontal movements made by your eye from one point to another. Example, I look at this one and this one. So, ganun, di ba? Nakita nyo, I don't know if you see it, like how my eye shifts from the left to the right quickly without my head moving. So, these are saccades. Dapat effective yung saccades ng bata. Pag medyo may problema tayo sa saccades ng bata, pwede siyang mahirapan sa reading because yung horizontal movements na jumping from point A to point B are very important when they are reading words and sentences. Kasi their eyes must be able to jump from one word to another quickly and accurately para makabasa sila ng maayos. Another movement, yung tinatawag natin na tracking. So sa tracking, yung target or yung tinitingnan ng bata or ng pasyente is a moving target, okay? So, it can either be moving from left to right or right to left or up going down or down going up. Okay? So, example, ito. Ayan. Okay? Okay. So, these are the way your eyes move in order to follow a moving object. Okay? So, very important yung tracking. So, yung other term natin for tracking is yung smooth pursuit, okay? So, yun yung ability ng eyes natin to move and smoothly and pursue a moving target, okay? So, nagmo-move siya accurately along with the speed and the movement of the target na tinitingnan. Another thing is yung ating tawag na convergence and divergence movements or collectively vergence movements. So, what is that? Say for example, I'm looking far away, look at me, my eyes are straight, but when I'm looking something at near, ayan, sa finger ko na malapit sa mata ko, nagko-converge siya. So, we call that convergence. And then, pag nakatingin naman sa malayo, magda-diverge ang mata, we call it divergence. So, this is another eye movement na we should also have para makakita tayo ng maayos. And lastly, we have the vestibulo-ocular movement. So, ano yung vestibulo-ocular movements? You are looking at one target that is not moving and you're the one who's moving, okay? Either you're moving your head from left to right, ayan. So, tingnan nyo, automatically, when I want to look at you in the camera, when I move my head to this side, my eye automatically moves to the opposite direction so that you are still in my line of vision. And when I do this, ganon, when I tilt my head up, my eye automatically goes down. And when I tilt down, my eye automatically goes up so that you are still in my visual field. Okay, so we call this vestibulo-ocular movements. So yun yung 4 types of movements na dapat meron ka, okay? So we have smooth pursuit, we have saccades, we have vergences, and we have vestibulo-ocular movements. And these are all very important. Sometimes, hindi siya nahahalata, okay? Hindi siya as obvious as the eye misalignment na halatang-halata na duduling or lumalabas yung mata. Hindi siya ganun kahalata. It's usually common lang nakikita kapag ka tinetest na ng isang practitioner, no? Pediatric or behavioral optometrist. Okay? So, it's best talaga to have your child seen. Huwag na maghintay ng symptoms, huwag na maghintay ng signs. Kasi marami sa kanila ang walang signs and symptoms. At marami sa mga bata ang hindi nakakapag-report or nakakapagsabi kapag ka may problema na sila sa mata. So, you go visit your doctor na lang. ₱300 below. I'm not sure anong brand yan. And I'm not sure kung ano yung modality, like, ano yung replacement schedule? Do you replace it daily? Is it a daily use? Is it a monthly use or a yearly use? I'm not really very familiar with these kind of lenses. I know that they're out there. They're in Shopee, in Lazada, or in any online platform, and they're being sold there over the counter without any prescription. I can't really, vouch on these kind of lenses. What I can say is contact lens materials are medical devices, okay? And there's a specific water content and there's a specific oxygen content, oxygen permeability, oxygen transmissibility that we check whenever we prescribe contact lenses. And as a doctor, we have to check if yung patient natin, ano yung status ng eye health niya, if normal ba, if meron siyang dry eyes, gaano ba ka-severe yung dry eyes niya, ano yung history niya. So, it would be best talaga for you to consult and visit your optometrist before purchasing contact lenses online. And it would be best if you get your contact lenses from a licensed optometrist to keep your eyes safe. Akala mo nakatipid ka sa Shopee or sa Lazada, pero hindi mo alam, mapapamahal ka kasi nagka-problema yung mata mo dahil doon. Diba? So, it's best to go to a professional, a licensed optometrist who is qualified to prescribe you and to advise you on the best contact lens that is right for you. Just like adults, no, sensitive din naman yung mata ng mga bata sa sunlight, lalo na yung mga really young children. So, it's important to let them wear sunglasses. And alam mo yung sunglasses na ito, these are not the sunglasses. I'm not talking about sunglasses that you can buy from a toy store na pang bata na kulay black lang or anything sa department store. No. Because these glasses are not made by legitimate ophthalmic laboratories, and these are not ophthalmic lenses, and it can maybe cause more problems to your child than it can help, okay? So, bakit? Kasi pag nagkaroon ng mga aberrations, kapag yung light na pumapasok sa sunglasses mo is hindi siya nare-refract or nagpa-pass through ng tama, okay? It can cause your child to have even more refractive error or magkaroon pa ng grado kahit na initially wala naman or initially mababa lang yung grado pero tataas yung grado niya because he or she is using sunglasses that isn't really medical grade, no? Parang laruan lang, okay? So, there's specific sunglasses and do you know that there's a lot of different kinds of sunglasses? They're not all the same. I hope I can also cover that in my next videos, different kinds of sunglasses. Nako, it's very hard to tell. It's very hard to tell. Pagka-parent ka and you're not a trained professional, you're not a trained pediatric optometrist, it's hard to tell just by looking at your child or just by observing symptoms because commonly they are asymptomatic. Bakit? Kasi we have two eyes, right? And commonly, patients who have lazy eye only suffer from a vision problem in one eye. So they have the other eye to do all the work. So, example, yung right eye niya malabo, yung left eye niya malinaw, so nakakabasa pa rin siya sa board, nakakabasa pa rin siya sa books niya, he can do almost anything, okay? Kasi nga, meron pa siyang isang mata na fully functional. Yung lazy eye niya lang hindi na-function. Pero, meron pa rin namang konting telltale signs sometimes, okay? Not all the time. Minsan, pagka lumalabas sa araw, they tend to close one eye, so they tend to close isang mata, so isang mata lang yung exposed sa araw, okay? That can be a sign of lazy eye. Another sign of lazy eye is kapag accident prone yung bata, yung mabilis siyang nami-misstep niya yung mga steps sa stairs or sa gutter, okay? Kasi very poor ang kanilang depth perception. Another sign, not all the time kasi minsan nako-compensate nila, but one of the signs is nahirapan silang mag-catch ng ball. Usually by around 3 years old, dapat kaya na ng bata mag-catch. Pero hindi pa siya nakakapag-catch kasi poor yung kanyang depth perception. Okay? And then, isa sa mga pinaka-basic na you can try at home, but you know, this is not a be-all, okay? So this is just something that you can try at home. You can just get a straw, okay? And then get a cotton bud and ask the kid to with both eyes open, ask the kid to shoot that cotton bud inside the straw, okay? So that we will be able to check if there's depth perception. And usually, kapag nahihirapan mag-shoot or parang nagkakaroon ng difficulty, no, parang hindi ma-shoot or basta dapat sharp yung pag-shoot niya. Pag hindi niya nagagawa yon, there's a big chance na very poor yung depth perception niya at meron siyang lazy eye. It's very easy to treat amblyopia in children. Kahit sa adults, no? It's not parang something that you need to be afraid of. You just need to undergo vision therapy. Of course, we need to correct the vision first and then undergo vision therapy para we can rehabilitate or we can slowly improve the eye and the vision back to its normal state. So, let me try to explain bakit ba nagkakaroon ng lazy eye or amblyopia. So, lazy eye or amblyopia is very common in patients who have uncorrected refractive errors for prolonged periods of time. Ibig po sabihin, may grado ho yung mata at hindi ho na-correct ng matagal na panahon. Okay? So, common to sa mga bata kasi ang mga bata hindi sila nagre-report kapag meron silang napapansin na problema sa mata nila kasi hindi nila alam na problema pala yon. Kaya akala nila normal lang yung nai-experience nila. So, let me cite an example that's I think much easier to understand. So, say for example, you have a kid and your kid is wearing yung kanyang, sa right shoes niya, he's wearing a size 5. Sa left shoe niya, he's wearing a size 10. Okay? So, of course, hindi siya komportableng maglakad with a size 5 and a size 10. Hirap siya maglakad, hindi pantay ang lakad niya. Pero hindi niya sasabihin yon, hindi niya i-express. Kasi akala niya, ganun talaga yung shoes na yon. Okay? Hindi niya masabi sa mommy niya or sa daddy niya na, Mommy, I think mali yung size ng right ko at ng left ko. Hindi sila nagre-report. So, they will go on for 1 year or 2 years or how many years na using that size 5 and that size 10. And as they keep on using it every day, every year, nagkakaroon sila ng mga compensatory mannerisms and habits. Okay? Hindi na nagiging straight yung kanyang lakad, dinadrag niya na yung isang feet niya para hindi matanggal yung shoe, yung mga ganon. Okay? And these mannerisms become habits. Okay? Ngayon, and these habits become more pronounced habang tumatagal. At doon na napapansin ng mommy or ng daddy na, ay, parang hindi na talaga straight to maglakad tong anak ko or hindi na siya makatakbo kagaya ng ibang mga bata. Okay? So, ngayon, chinek nila. Nung chinek nila, doon pa nila nalaman na, ay, iba pala yung size ng right at iba pala yung size ng left. So, ngayon, papalitan nila ng size 5 ang right at size 5 ang left. Pantay na. Pero, after how many years of using size 5 and size 10, yung kanyang mannerism sa paglalakad hindi na normal. So, itong mga abnormal mannerisms and abnormal habits of walking niya, hindi niya ito maa-unlearn in just 1 day dahil lang nagsuot siya ng size 5 sa right at size 5 sa left, right? The child will need to practice and probably go for a physical therapy para makapaglakad siya ng straight at maging tama ulit yung kanyang gait or yung kanyang manner of walking. So, ganun din sa mata. Kapag ka-prolonged yung refractive error or yung grado na hindi nako-correct, nagkakaroon na ng lazy eye or hindi na nagfa-function yung mata na mas blurry, and that's the defense mechanism of the brain to keep the image clear. Okay? So, ang ine-entertain niya lang is yung right eye or yung left eye na nagfa-function. Yung another eye na lazy eye, hindi niya ine-entertain. Okay? Ngayon, it doesn't mean na binigyan na natin siya ng eyeglasses para makorrect yung kanyang vision. Overnight, clear na kaagad. Okay? Because that brain and that eye will need to unlearn yung kanyang years of trauma na hindi siya nag-function. Okay? At hindi siya na-entertain at nagagamit ng brain. At kailangan na natin i-change yung mga habits ng eye na yon at ng brain na yon and rewire the visual pathway, the nerve pathway from the eye to the brain. I-rewire yung communication and i-rehabilitate lahat. It's not a quick overnight fix, but it can be done. So don't be afraid of lazy eye diagnosis. Just accept the diagnosis and work towards vision correction and vision management either through glasses, prisms, or vision therapy, or a combination of all these methods. There's a lot of ways to manage strabismus or cross eyes. We can use eyeglasses, we can use prisms, we can use vision therapy, we can also use strabismus surgery, or any combination of those managements that I just mentioned. So, there's a proper way of using all of these methods, no? There's just like, there's different knives, right? There's a knife for a cake, there's a knife for a meat, there's a knife for a fish, there's different. So, you need a doctor who knows how to use what instrument to use and for what specific conditions they're going to use it for. Color vision deficiency is commonly hereditary, okay? So, medyo dapat nagbabantay na tayo kapag we have someone in our family, either sa mother's side or sa father's side, na merong color vision problem. Okay, that's one. It's hereditary. Number two, you have to observe, kung yung bata is kayang mag-tell ng colors or not. Sometimes, syempre, it's normal na hindi pa sila makapag-tell ng colors or hindi pa nila memorize yung colors. So, one of the basic things that we can do is to do matching, okay? So, say for example, you can use snips or yung M&Ms. Diba, these are colored candies na iba-ibang kulay. So, you can like put green, red, blue, brown, yellow. So these colors there, you can line them up. And then you can give your child the same colors. And you ask the child to group, no, or to put what color she has on the same color. So that's one of the ways that you can check kung kaya ba niya mag-determine ng color or not. Pagka may problema sa ganong activity, you just try to visit a doctor, an optometrist, who can make a color vision assessment, okay, for the kid. Sa color vision assessments, usually we have the Ishihara vision assessment, color vision screening assessment, and then we also have the Farnsworth Lantern vision assessment. Farnsworth Lantern vision assessment is a specific vision assessment commonly used for patients who have yung parang nag-a-apply for semen. Very common yun sa kanila because pagka they're at work na sa barko, they are looking at colored lights for signals. So, Farnsworth Lantern uses colored lights during the assessment. So, it's very much close to their work conditions talaga. And then, ang maganda rin sa Farnsworth Lantern, it can help determine kung anong type of color vision problem ng patient, whether it's red, yellow, green, or blue. Okay? And it also helps us determine whether it's mild, moderate, or severe. Minsan din may mga patients na bumabagsak sa Ishihara color vision and we advise them to have a Farnsworth Lantern test and then they pass sa Farnsworth Lantern test. So, yun. It's a good parang indicator for false positives or false negatives ng mga Ishihara. If you want to encourage your child to have healthy vision habits, you start with yourself because it's very hard to teach a child when you are actually not a good example. Okay, so first is, let's increase outdoor time. Okay, so dapat meron tayong 1 to 2 hours na outdoor time. 1 hour in the morning, 1 hour in the evening, or in the afternoon. Say for example, mga 6 a.m. or 7 a.m. na outdoor time, or parang sa hapon naman, we can like have an outdoor time ng 4 o'clock. Okay, that's very important. So you do it with your kid. Next is you lessen your screen time or your use of gadgets and tablets. So kapag ka mga unnecessary social media scrolling na lang, maybe you just put the phone down and, interact with your child. Because sometimes, we're guilty as parents, diba? We just like social media so much. We're so engrossed with it, even if it's no longer important. It's just a pastime na lang. We spend so much of our time in the phone, tapos katabi natin yung anak natin. And they're also doing the same. They spend so much in the tablet or in the phone, and we're no longer interacting with our kids, with the people we're with in the house, right? So maybe you can just, when you're in the house, you just set aside the phone, be with your kid, and have your kid set aside his tablet also or his phone, and interact with each other. One of the things that I do, I don't know if this is okay or not, but it's just something that I can share, is I like to sing. And my other kid, she likes to sing as well. So sometimes when we're at home and I want her to stop using her phone and I just want to stop using my phone, I just turn on the TV and sing some video-k and we sing together. Sometimes it's nursery rhymes for her and sometimes it's like love songs for me. But it works both ways. We have this thing we call congenital glaucoma. Usually it's inborn. Isa sa mga signs and symptoms niya, pagkalabas ng baby, nakikita mo parang nagbabulge yung eye or bilog na bilog or malaki or kulay blue or kulay gray yung eyes. We call it dull eyes. Ang cute-cute ng mata, ang laki, ang round, parang anime. Pero actually, it's not a good thing because it can be a sign that there's congenital glaucoma. And this is not a good thing because it can cause blindness in very young children. But don't worry because pediatric ophthalmologists are well trained to manage these kind of problems. And if there's any vision impairment, you can go to an optometrist who specializes in low vision rehabilitation para malesen yung impact ng vision impairment, malesen yung kanyang visual disability, and he or she can live a normal life. Alam nyo, iba-iba kasi yung severity ng cataract. Kapag ka nakita mo na talaga na yung center na area, yung pupil, no, yung pinaka-black part na center ng mata is puti na, ibig po sabihin nun, makapal na yung cataract niya. But there are times when the cataract is not yet fully developed, hindi pa siya ganun kakapal, but it's already there. Okay? So, it's still best to really go to a doctor. Pag nakita mong puti na, yun, cataract na talaga yun. But that's severe na mature cataract na. Minsan, nadidetect pa yun kapag ka-early pa. There was one time, I had a patient here, the mom kept on bringing one child to me kasi nga may eye misalignment. So, we have been doing vision therapy and all. And then, I saw she had another kid. This kid was younger. And then, she's never had him check, no? Yung mata niya. So, I just encouraged her one time, can we just check his eyes also? Because he's always here and we never checked his eyes. Maybe there's a problem also. Hopefully, there's none. So, yeah, out of the blue, she just had him checked. And I saw that he already was starting to develop some form of cataract. And he was advised to, I advised the mom, we assess the vision, if the vision is okay pa or not. So far, he can still see, no? So the vision, the cataract was still not mature, ganun ka-mature, hindi pa ganun kakapal. So, pwede pa kaming mag-glasses, pero eventually, he may really need cataract removal from a pediatric ophthalmologist. And I think I've already referred that kid. So, let's not wait na lang for symptoms talaga to be very obvious, because a lot of times with children, when there's obvious signs and symptoms, it's usually at its worst. So it's best to go to a doctor, go to a pediatric optometrist, even if there's no signs and symptoms yet, for prevention or early detection. Yes, there's a lot of special considerations with special contact lenses for kids. We have to check the modality, kung gaano ba frequent yung replacement natin. Do we need a daily, a monthly replacement? What kind of material we're going to use, whether it's a GP lens, a gas permeable lens, or a soft contact lens. Will it be used overnight? Will it be used for one day lang? Will it be used during the day only? There's a lot of things, so it's best if you're considering contact lenses for your child, you visit a specialty contact lens optometrist, okay? Bakit ba natin pinaprescribe ng contact lenses yung kids? You know what? There's a lot of very good effects ng contact lenses, specialty contact lenses sa mga bata na hindi kayang ma-achieve ng eyeglasses. Okay? At hindi rin natin ma-achieve through surgery, of course. So, first and foremost, kapag sobrang taas ng grado ng bata, it's best to give him or her a specialty contact lens. Lalo na sa mga patients na may aphakia or kunwari, may congenital cataract yung bata. So, tatanggalin yung lens niya, yung lens na may cataract, para mawala yung nakabara sa paningin niya. And magkakaroon siya ng very high plus na grado. Ngayon, pagka nilagay mo yun sa salamin, pwede niyang ma-improve yung vision ng bata, pero to a limited degree. Okay? But, if you use specialty contact lenses for this patient, this same patient, itong batang to, mas maganda yung kanyang vision correction at magiging mas maganda yung kanyang visual development. So, mas less prone siya sa lazy eye at mas makakapag-function siya like normal kid na walang problema sa paningin. We have these pediatric contact lenses. Alam mo, sa pediatric contact lenses, we can start as young as 1 month, 2 months old for pediatric contact lenses. But, yung magmamanage nun, dapat talaga pediatric optometrist na trained sa specialty contact lens, and it's very hard to find. Okay, so commonly, itong mga retinal disorders na to, wala rin siyang telltale signs and symptoms, okay? Commonly. Isa-isahin natin yung 5 common retinal problems in children. Let's start with retinopathy of prematurity. So ano yon? If a child is born premature or if a child is born underweight, malaking chance na magkakaroon siya ng retinopathy of prematurity. So, because of prematurity or malnourishment, hindi nag-fully develop yung kanilang retina. Okay? And when they're born, their underdeveloped retinas can have some effects in their vision. Hindi sila makakita ng maayos or very poor yung kanilang visual ability. Okay? That's one. Next naman is yung tinatawag natin na retinoblastoma. This is very scary, but it only happens in 2% of the time, children. So, pag merong retinoblastoma, meron tayong cancer sa mata. And it should be detected early. Isa sa ways that parents can see it is kapag parang hindi pantay yung kunwari, magpa-flash ka, magpa-picture ka sa anak mo. Tapos, yung isa, mas puti kaysa sa the other one. Like, isa is red, yung isa is puti, white. So, may chance na merong something siya sa loob. Either it's retinoblastoma or it's cataract. Okay, so, pagka may mga nasisense kayong ganon, don't take it lightly. You visit a pediatric ophthalmologist for that. Pwede rin for, sa pediatric optometrist to screen if there's really a problem there and, you get a proper referral. Okay? And then, another thing is yung uveitis, yung merong kang infection sa eyeball mo. So, minsan, merong grabe yung redness, general inflammation, and then merong pus or discharge, okay? Another thing is yung tinatawag natin na myopia. Okay, so kapag ka myopia or nearsightedness, may myopia or nearsightedness yung isang bata, very prone siya sa retinal detachment, macular degeneration, and glaucoma. So, it's best to go to a myopia control specialist para ma-monitor ang myopia, ma-slow down ang myopia. At the same time, ma-monitor if there's any eye disease that's developing because of the myopia that the patient has. Of course, retinitis pigmentosa is a genetic eye disease. Corneal dystrophies is a genetic eye disease. Color vision problems is a genetic eye disease. So, maraming diseases of the eye ang caused by genetics natin. So, we can't do anything about that unless we do genetic engineering. Hindi naman natin mape-prevent yon. But, we can soften the impact. We can manage it. Okay, how? If you visit a pediatric optometrist who specializes in low vision rehabilitation, we can help manage yung mga ganitong cases para ma-lessen yung kanilang visual disability at ma-improve yung kanilang visual skills, ma-improve yung kanilang ability to do their daily tasks even with their limited vision. And that's what we do for low vision rehabilitation. Children won't develop age-related macular degeneration because from the word age-related, it's commonly associated with elderly patients. But young children can develop macular degeneration or maculopathy, diseases of the macula, because of their exposure to myopia-related na mga factors like very long na axial length, mahaba yung kanilang eyeball, or very aggressive yung pag-progress ng kanilang myopia. Common yon yung macular degeneration sa mga patients na merong myopia or nearsightedness. Thank you, and please don't forget to like, comment, and subscribe!